Welcome, everyone. Thank you for joining us for today's webinar. My name is Diana Echenique. I am a senior program analyst for the Hispanic Latino communities at the Office of Minority Health Resource Center, commonly known as OMHRC. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the question box on the right bar of your screen. We will have time for questions at the end of the webinar. Please provide us with your feedback with the evaluation that will pop up at the end of this webinar. All participants who register for today's presentation will receive a link with the recording of today's webinar in a week time. Next slide, please. Thank you. Our speaker today is Betsy Rodriguez. Betsy Rodriguez is a nurse, diabetes educator, national and international speaker on diabetes-related topics, bicultural specialist in health communication strategies, and author. Presently serves as a senior public health advisor in the Translation Health Education Evaluation branch in the Division of Diabetes Translation at the Centers for Disease Control and Prevention. At CDC, Ms. Rodriguez provides technical assistance and support to state grantees, national diabetes-related professional organizations such as the American Diabetes Association and the American Association of Diabetes Educators, as well as community-based organizations. At the international level, Ms. Rodriguez provides technical assistance and support to the International Diabetes Federation. Betsy also provides her expertise to various groups at CDC, including the Community Health Workers Work Group, the Community Clinical Linkages Work Group, the Work Group on Translation, and the Multilingual Content in Digital Media Community of Practice. My apologies for that. Nationally, Betsy Rodriguez represents as a member of the AADE, Favorably Reviewed Evaluation Group, and is the chair of the National Health Disparities Community for ADA. At the international level, Betsy is a member of the Blue Circle Voices of Diabetes. Ms. Rodriguez also has commended by many community-based organizations as a supporter of racial and ethnic minorities and vulnerable populations in the United States and Latin America. She has a master's degree in nursing with 3 licenses specialties: medical, surgical nursing, education, and gerontology nursing. She has also received a diplomado in chronic diseases. For the past 18 years, Ms. Rodriguez has been working as a specialist in bicultural health communication strategies and in the development of diabetes educational resources for Hispanic, Latinos, and other ethnic minority groups as part of the National Diabetes Education Program of CDC. During these 18 years, Ms. Rodriguez has diligently worked to support Hispanic Latinos living in the U.S. who experience inequity due to diabetes. Please help me to welcome Ms. Betsy Rodriguez. For today's objectives of the webinar, we have discussed the findings of the Hispanic Latino migrants and seasonal farm workers needs assessment findings. Learn about the new CDC and NDEP MSFWs webpage. Strengthen collaborating efforts among the national health agencies to contribute to reduce diabetes among vulnerable populations in the U.S. by expanding outlets for capacity building among Hispanic professionals and CHWs, promotores de salud, serving Hispanic Latino populations. Next slide, please.
So thank you very much, Diana, for that introduction, and thank you for the invitation to be with all of you talking today about the Hispano-Latino, migrant, and seasonal farm worker need assessment that we conducted. So in the slide, you'll see the overview of the presentation today. Prior slide, please. Next, please. Next, please. So today we're going to be having a brief introduction. Then I'm going to be talking to all of you about the methods we use while doing this audience need assessment. I'm going to be sharing some results. And at the end, you will get a summary of the findings. And finally, we're going to be showcasing with you the limitations and a new web page section under the National Diabetes Education Program webpage devoted to migrant seasonal farm workers. Next, please. Next. So the activity conducted was an audience need assessment. So what is an audience need assessment? An audience need assessment is a systematic process for determining and addressing needs or gaps between current conditions and desired conditions or wants. We were intrigued by knowing what are the barriers, what are the constraints, what are the challenges that migrant seasonal farm worker are living. So the purpose of this audience need assessment was to better understand the educational needs of Hispano-Latino migrant seasonal farm workers with respect to prediabetes, to diabetes, and also to identify what, if any, cultural or linguistically tailored materials, messages, products, or campaigns exist for this audience need assessment. Next, please. So let me begin by giving you a very brief description of this population. Who are migrant and seasonal farm workers? They are an integral part of the U.S. agricultural market, comprising 1/3 of the agricultural labor workforce. Migrant seasonal farm workers are individuals who must leave their permanent place of residence to seek employment in agricultural work. On the other hand, seasonal farm workers are people who do not have to leave their place of residence in order to find agricultural work. And these definitions are coming from Migrant Clinician Network. There's an estimated 1 to 3 million of migrant seasonal farm workers in the U.S. agricultural system each year. Most of seasonal farm workers are from Mexico. However, I have to say that they're also come from a range of countries, including Puerto Rico, Guatemala, Honduras, Jamaica, República Dominicana, Cuba, and Haiti. An exact number of migrant seasonal farm workers is unknown due to variations in agricultural needs for each season. Next, please. So let me share with you some of the characteristics of this population. The average migrant seasonal farm workers is age 36. Over 75% of migrant seasonal farm workers are between the ages of 25 and 35 years old. And there is an overwhelming majority are men, like 78%. California, Florida, Texas, Washington, Oregon, and North Carolina account for half of hire farm workers, but you can find migrant seasonal farm workers in all 15 states. Next, please. Migrant seasonal farm workers typically plant, cultivate, harvest, and pack fruit, vegetables, and nuts. However, some farm workers are also involved in the fishing, meat packing, and dairy industries. Next, please. So what were the research questions that we posed to do this audience need assessment? So we wanted to know, based on the limited data available, what is the burden of diabetes and prediabetes among the Hispano-Latino migrant seasonal farm worker, and how much of perceived burden is of diabetes and prediabetes among this population. What factors influence diabetes prevention and control among Hispano-Latino migrant seasonal farm workers? And in there, we were looking to what were the common barriers and facilitators to preventing and controlling diabetes in this population. We also wanted to know about barriers existing to reaching this population and to learn about the most effective channel for reaching, especially disseminating and developing materials to educate migrant seasonal farm workers. Next, please. As part of the research questions, we were also looking into what resources published and unpublished were available to educate Hispano-Latino migrant seasonal farm workers, especially around prevention and control of diabetes. And to what extent do the existing materials meet diabetes-related educational needs for the Hispano-Latino population? And finally, we were looking for suggestions from organizations and individuals who works directly with Hispano-Latino migrant seasonal farm workers. Next, please. And also we were looking what were the gaps. So let's talk a little bit now about the methods. Next slide, please. So we review published and unpublished literature, around 154 articles published and around 20 unpublished literature. We also conducted an inventory of existing educational materials, and for that we look for many organizations, especially those that have been dealing with migrant seasonal farm workers for many years. But we also look about what ADA may have, what the National Diabetes Education Program may have, what CDC may have. I mean, some other players in the arena of diabetes and diabetes prevention. We were looking to their websites and their literature and the information to see what kind of resources we have. And so as a result, we were able to catalog 214 resources in total. We also conducted consultation through a task group composed of organizations and promotores who has been serving migrant seasonal farm workers for many years. And then finally, we have key informant interviews, 5 migrant seasonal farm workers organizations, and 6 promotores de salud that serves migrant seasonal farm workers. So let's move to the results now. Next slide, please. Next slide, please. So what we were able to find out, what available diabetes educational resources are. As I told you, the assessment team identified 214 available resources. Over half of the resources were fact sheets available in English and Spanish for individuals with diabetes and or reading the topic or regarding the topic of diabetes and management. We were also looking for diabetes prevention, and in the findings I will be sharing you what we find out specifically in prediabetes and diabetes. I have to say that many of the resources that we identify, even though they might be in Spanish, some of them were not following the ADA standard of care, or they were not following the physical activity guidelines, or they were not following the nutrition guidance and things like that. So next slide, please. So what was the burden among migrant seasonal farm workers? There is very limited information on the perceived or actual burden of diabetes and prediabetes among Hispano-Latino migrant seasonal farm workers. No large-scale study has been conducted to estimate the burden of the disease. However, some of the data that is available, as well as data for the Hispano-Latino population in overall, indicate the scope of the problem within this population. The Migrant Clinician Network in 2001 estimated that 25% of the migrant seasonal farm working in Michigan, age over 20, have diabetes. And also noted a high prevalence of family history of diabetes among workers surveyed in Pennsylvania. Due to their lifestyle and lack of access to routine, high-quality health care, the burden of the disease is likely to be higher than the already high prevalence of diabetes and prediabetes in the Mexican American and in the Puerto Rican population. This assumption was supported by the interview findings. Participants cited diabetes as a concern, amplify both during gestation and when combined with other chronic health conditions such as high blood pressure, high cholesterol, and obesity. Two studies provided an estimate of the degree to which diabetes is perceived to be a burden among this population. One study found 79% of farm workers surveyed cited diabetes as a health concern. Another study found that although 25% of male and 38% of female farm workers perceive diabetes to be a health problem, 42% of male and 62% of female farm workers actually requested health services related to diabetes, indicating that concern related to diabetes might have been underreported. So as you can see, the big problem here is underreported burden of diabetes among migrant and seasonal farm workers. Next slide, please. So what are the factors influencing diabetes prevention and management? We find that the findings can fall under two categories: cultural factors and social and environmental factors. Cultural factors, for example, in cultural factors, we find out that the assessment found numerous barriers to diabetes prevention and management among Hispano, Latino, migrant, seasonal farm workers, including cultural factors and factors associated with the nature of migrant seasonal farm workers' lifestyle. Factors that can influence the lifestyle changes necessary to prevent or control diabetes among Hispano, Latino farm workers include the following, like perception of weight and body image. Being overweight is seen as healthy, so overweight is equated with health and or success, and eating is considered a source of pleasure. Perception of diabetes as a health issue. Diabetes as a health issue is a huge problem. Adjustment to high blood pressure often results in disbelief of diagnosis. Diabetes is viewed as a death sentence. Next slide, please. Perception of foods. Healthy food is seen as inexpensive and lacking of flavor. Additionally, consider the importance of gratification among resources available to migrant seasonal farm workers. The diet usually is high in carbs, high in fat, and healthy eating is associated with a lot of pleasure and discomfort. Healthier options may seem to be out of reach due to the cost. So acknowledging and addressing this cultural perception of weight and body images, diabetes is a health issue. And food, when providing diabetes education, may assist in overcoming these barriers. Next slide, please. Let's look now about migrant seasonal farm workers' social and environmental factors. In addition to cultural factors, one aspect of Hispano-Latino migrant seasonal farm worker lifestyle were identified as posing barriers to preventing and controlling diabetes, which are access to healthcare, work environments, living environment, and food insecurity. Access to healthcare, there's limited availability of nearby clinicians, and accessibility and affordability of health insurance and other medications can be a barrier. In places where they were clinics or they were available, so then the issue came about the language. Many of those clinicians or healthcare providers, they were unable to speak Spanish. And also take into consideration that some of the populations that are under migrant seasonal farm worker the majority are from Mexico, as I said before, and many of them, they don't even speak Spanish. they might be speaking dialects, the most common one being Mixtec and Zapotec. So the living environment is another huge issue here. There is a need for alternative methods of preparing healthier meals due to crowded and unsanitary living conditions and or the lack of cooking facilities for preparing home-cooked meals. Next slide, please. Food insecurity. Food insecurity, a study of farm workers in Georgia found that 63% did not have enough food, with undocumented workers experiencing nearly 3 times higher food insecurity than documented workers. Then in terms of work environment, long working hours, outdoor working, and long distance travel, both seasonally and daily between home and the work site can be barriers to healthy eating. Hispano-Latino living environments are reported to often be crowded and unsanitary. This makes access to adequate cooking facilities and safe venue for physical activity limited, presenting barriers to preventing and controlling diabetes among Hispano-Latino population. The food insecurity aspect, let me make an emphasis in this one, found to be particularly acute among undocumented migrant seasonal farm workers and among individuals with children, was also associated with lack of access to cooking facilities as well as transportation problems. No facilitators to diabetes prevention or management were identified. Next slide, please. So what were the barriers to reaching migrant seasonal farm workers? The published and unpublished literature, as well as information from task group members and interviews, indicated that both language and literacy pose significant barriers to reaching this population with diabetes-related education. Lack of fluency in English was cited as a barrier, particularly related to accessing health care. But a high percentage of Hispano-Latino migrant seasonal farm workers were also noted to lack sufficient literacy to comprehend written material, particularly of a complex nature, in English or in Spanish. The work schedules, noted above as a barrier to diabetes prevention and control, were also cited as barriers to reach Hispano-Latino migrant seasonal farm worker and diabetes-related education. Long hours, limiting time for diabetes education. The promotor or community health worker model was found to be most appropriate for working with Hispano-Latino migrant seasonal farm workers. However, the inability of promotores to find a good time to meet with migrant seasonal farm worker was a barrier too. So from one side, you can see that the promotores model seems to be one of the approaches that can fulfill the needs when it comes to diabetes education. But then on the other hand, there is a lot of inability for promotores to find a good time to meet with migrant seasonal farm workers. There is one particular story that I recall from one of the promotoras that was interviewed. She was describing to me how they came up with the idea of diabetes teatros. And that was basically a mobile platform that promotores were placing in the middle of the fields or close to the areas where migrant seasonal farm workers take some time. So in that aspect, they created like a teatro show. And through that strategy, they were sharing the health messages in a more interactive and entertainment way. That was the only strategy that they were able to identify to reach some segment of this population in some states where there was no other means, no other way on how to reach them. Next slide, please. So what were the recommended strategies for these for reaching this population? As I told you before, community health promotores de salud seems to be trusted sources of health information. On the other hand, I also think it's important to mention that many of the promotores de salud that are working with this population, They has been themselves migrant seasonal farm workers. They has been in the field picking fruits or veggies, whatever might be the case. But, or some others are coming from family who has been migrant and seasonal farm workers. So they know all the details of this living style. So they have been, so this is why the promotores model, especially those peer-to-peer kind of situation that I already described, has been effective in reaching this population because they know the reality of living as a migrant seasonal farm worker. They were also talking about organizations that are using promotores to track the dissemination of educational resources. A big recommendation was about the need of tailoring existing material, addressing the issues of migrant and seasonal farm worker population. Next slide, please. The big gap that this out-there need assessment identified was the lack of educational resources for people with prediabetes or in diabetes prevention. We were unable to find resources respecting that. There were resources around diabetes control and management, but we were unable to find educational resources in Spanish addressing migrant seasonal farm worker needs with prediabetes or diabetes prevention. Next slide. In terms of other gaps in educational materials, there were lacking of content on medication and medication safety in the context of migrant seasonal farm workers' living conditions. Material that address the needs of individuals with low literacy. Many of the resources that we identified, the reading level was higher than 8th grade. There were educational resources that were dense in written information, lacking of a lot of audiovisual. And then on top of that, the information written was using a lot of medical terms. In terms of the first gap that I identified here on content on medications and safety, there was nothing around, how to manage for those that are using insulin when the temperatures are, sky high during summertime. Things like that that are the reality of people who are doing this type of work. We were unable to find specific information addressing the needs of people living with diabetes and being a migrant seasonal farm workers. Also, materials that take into account limited access to healthier foods and beverage. Next slide, please. So now let's move on to what were the participant suggestions. The first one was to use simple, more direct language, use illustration to communicate key messages. And in terms of that, like for instance, some of them recommended to partner with organizations that are serving migrant seasonal farm workers to develop low literacy resources that could also benefit some other populations. And in terms of specific ways on how to share this information, they were mentioning using pictograms or infographics to display information in an easy to follow format, taking into consideration that it will be using more images and less text. Short videos addressing the issues of migrant seasonal farm work and encounter as a resource for community health workers or promotores and others to use in health clinics or in other venues serving migrant seasonal farm workers. Also, considering enhancing the capacity of farm owners. They spend a lot of time, the interviewees spend a lot of time talking to us about the importance of establishing partnership and collaboration with the farm owners, educating them about the needs of people living with diabetes and how a well-controlled person living with diabetes could be more productive if the health concern, in this case, talking about diabetes, is under control. So engaging farm workers in ensuring a healthy workforce and a work environment. Considering various communication strategies For written materials, I already told you the pictograms or the infograms or short videos, but they also talk about radio and interpersonal communication. Radio, why? Because in some of the fields, these people sometimes they have their radios on all the time, so it will be a good venue to reach health information with them. And then the interpersonal communication. Next slide, please. In developing and disseminating diabetes-related materials, key informant indicated that when developing educational materials, they usually review existing materials, convene an advisory group, and they convene field testers. They were saying that it's very important to convey an advisory of group of people that have been working with this population for many years, because they will be your subject matter experts. So working with compromise of subject matter experts that know the ins and outs of this population will be a big step to do. And then pre-testing or pilot testing materials with the target audience. And because by gathering all of this information, this process will be enriched. So they also emphasize that this is an iterative process. Next slide, please. So let's move on to the summary of the key findings. Next slide, please. So in summary, there is limited information about the prevalence of diabetes among Hispano-Latino migrant seasonal farm workers. There are cultural factors, including perception of weight and body image, food, and diabetes as health issues, influence diabetes prevention and control among migrant and seasonal farm workers. The nature of migrant seasonal lifestyle, like crowded and unsanitary living conditions and the food insecurity, affects prevention and control of diabetes. And low literacy, long work hours, and limited English fluency are major barriers to reaching Hispano-Latino migrant seasonal farm workers with diabetes-related education. Next slide, please. As I mentioned, the use of community health workers promotor mothers appear to be an effective channel to reach migrant seasonal farm worker population. And if these promotores is kind of a peer-to-peer situation, meaning that our promotores that has been living as migrant seasonal farm worker or are coming from family of migrant seasonal farm worker, is even better. Promotores typically receive educational materials from the organization they work with and or professional affiliations. The big gap, as I mentioned before, is around diabetes prevention and pre-diabetes. There is not even messaging. We weren't unable to find correct messaging for this population in those two aspects. So the interview participants recommend using simple, more direct language when developing materials and incorporating illustration to emphasize key messages. As I mentioned to you, they talk about pictograms, they talk about videos, and they talk also about radio and interpersonal communication. Next slide, please. There were some limitations to this audit assessment. Next slide, please. The findings were limited only to publicly available materials. Although we touch on published literature, there were not a lot of electronic body of diabetes-related materials possible. Also, the findings from interviews were very limited to a small convenient sample. And the majority of the participants, especially the promotores, were mostly from Texas. Next slide, please. So what are potential next steps after conducting this audit assessment? Number one, partnership. I don't know how many times we heard that during the interviews, partner to partner to partner to partner. Why? Because partnership can help promote and improve existing messages and materials. A lot of collaboration, like sponsor meetings with migrant seasonal farm worker orgs to share best practices and to help them develop materials. They also talk about partnership and collaboration with farm owners. And in terms of education, educating promotores using existing materials about the importance of diabetes prevention and pre-diabetes. So if we increase the capacity of community health workers, promotores de salud, in two areas we already know is the gap in this population, it would be a good next step to take in. Next slide, please. As a result of this audit need assessment, the National Diabetes Education Program developed a web section under the National Diabetes Education Program webpage. It's called Resources for Migrant and Seasonal Farm Worker. As I told you, we were able to catalog many resources, but I would say more than half of them, we were unable to include them in our web section of resources for migrant seasonal farm worker, because as I mentioned before, many of them were not following ADA standards or guidelines. They will not be following the physical activity guidelines, or they will not be following nutritional guidelines and things like that. So we were unable to find, to include those in our webpage section. So we ended with a very limited list of resources that are here, but at least people now may have a web section when they can locate some of the resources that are addressing the needs of migrant seasonal farm worker. So we have resources for migrant clinician network. We have one around flu prevention. We have around A1C patient education tool. We have some others that are devoted to physical activity, food health, and living with diabetes. Some of them are available in English, some of them are available in English and in Spanish. Next slide, please. So with this, I conclude my presentation from today. As you can see, I were addressing with you what were our research questions. We're looking about the burden. We were looking about resources available. We were looking about barriers. We were looking about how to best reach. And then we were looking finally to possible solutions to the problems and the needs that we identified in this audit need assessment, to finally end having a web page section. So it's not a panacea, it's not the solution, but it's one contribution that our program is doing to address the needs of this particular population. So I will stop here and I will give the virtual mic to my dear friend Diana so she can help us with the question. Thank you very much.
Thank you, Betsy, for your presentation and sharing this, the results of this assessment, this research study. We have a large number of questions here. One of the first questions from the public is, was the research performed only for published and unpublished literature in English? And if so, would this be a limitation given that there could be publications on the topic in Spanish?
We were looking primarily to resources that were both in English and in Spanish, but I have to say that we have to dig in very deeply in order to find information that will fulfill the criteria that we have for this audit need assessment. So I have to admit that it was a challenge.
Okay, thank you, Betsy. Following up the question, there is another one related to that. Of all the educational materials identified, how many have been validated with the migrant seasonal farm workers community? What about the educational needs of indigenous, non-Spanish speaking migrant seasonal farm workers?
Well, you know, the resources that we ended included in the webpage section that I was talking about um, they they were cleared through our CDC clearance process. And in this clearance process, they were looking to see if the information was science-based, if it was following the nutritional guidelines or the physical activity guidelines or the ADA standard of care, things that are like that coming from the science standpoint. We're also looking to the type of language they were using, in if it was available in English or in Spanish, but how the resource was put in place by the organization that we were able to identify the group. We did not dig in that aspect. But knowing the fact that I have seen some other processes from some of the migrant seasonal farm worker organizations that we work with to do this authentic assessment, I know that it's the natural process of this organization to do pilot testing. So, but if that process was conducted and how that was conducted, I mean, all those details related with the product development, we didn't know, because we didn't, that was not part of the research audit need assessment that we were doing. So we are assuming that that was part of the process, since they mentioned that the process should include testing with the audience. Well, in terms of indigenous, there is almost nothing. We were unable to find anything related with that. And so just the fact that it's available in English and in Spanish. We know that there is a need, but we were unable to find anything.
Okay, great. Thank you for that answer, Betsy. One more question here is, um, what factors influence diabetes prevention and control among Hispanic, Latino, migrant seasonal farm workers?
Well, as I told you, it's the working style. It's the lack of health insurance, the lack of healthcare clinic, the lack of the way they work, the insecurity around the issues of living and working on those conditions. So those were primarily the things that we were able to find out. Like access to healthcare, the work environment, the living environment, and the food insecurity. Those four, I will say, that were the barriers that were predominant under this outstanding assessment that we were working against preventing and controlling the diabetes. Access to healthcare, work environments, living environments, and food insecurity.
Wonderful. Thank you for that information. Another question is, uh, the eh, the migrant seasonal farm workers living conditions pose or not barriers to maintaining a healthy diet in particular.
Well, many of these people, what it's easy for them to carry and prepare in the field might not be what a person with diabetes could need when we're talking about healthy options and healthy eating. Many of them are having like noodle soups that you just a matter of adding water and warming that up, and then sugary drinks and things like that. It's kind of the type of food that sometimes they bring, or if they bring the typical cultural food, they is usually high in carbs and high in fat and high in sugar. So that's in terms of healthy eating or healthy cooking. And of course the food insecurity that have been mentioned so many times. So even though they're doing a lot of physical efforts, that not necessarily that will run under category of physical activity. And
Hmm.
so this is not the typical work, Diana, when you work certain hours, then you have a break, and then you have an hour to have your lunch, and then you go back. You can't even go outside or drive or whatever. And in in some work you can even go to your home, you know, and then come back to the work. Well, this is not the typical work they're doing. It's a very heavy work, and the time they have for having their breaks is very limited as well. So that poses a lot of pressure, especially for people living with diabetes, when eating healthy, doing physical activity, including the medication management into the daily activity, it's part of keeping a chronic disease like diabetes. So that might not be so natural to this kind of lifestyle.
Thank you for that insightful piece of information, Betsy. And I will keep going with the questions because we have a large amount of questions here. How can promotores be useful if they are having problems reaching out to the migrant seasonal farm workers population?
I will take that question from another angle. I think that organizations that are reaching migrant seasonal farm workers should devote some time to increase the capacity of community health workers and promotores de salud in terms of increasing their knowledge and the skills, diabetes related, and then being able to relate that diabetes related knowledge to the living conditions and work environment of the migrant seasonal farm worker. So it's like recreating a new curriculum, I will say, Diana. So because the diabetes is the diabetes, and the pancreas will always be located in the same place in our body, you know, but how the information will be tailored to fulfill the needs of the migrant seasonal farm worker for those that have the condition is one aspect. And for those that are at risk or even have prediabetes already, so we have to increase the knowledge and the skills of these promotoras so they can go then into the fields working with this population, teaching them the right concept about preventing or delay the onset of type 2 diabetes, or managing effectively the diabetes, taking into consideration the constraints that this population have in the work environment.
Certainly. And having mentioned that, there is a comment that was posted by another participant right after the question was asked. Please keep in mind that the percentage of farm workers that are true migratory, for example, change residence for agricultural work, is very small compared to all farm workers.
Yes, that's true.
The following question is, where can we find pictograms in Spanish created by CDC?
We don't have any. I have been advocating for developing some. I know learning about diabetes, which is not an organization from CDC. I know that they had at some point a project to develop pictograms, but you know, it's easy to say develop pictograms, but when you are in the arena of developing educational resources, I mean, a pictogram, think about this. Any image that you may use may need to have the same meaning for anyone who will be looking to the pictogram and using as a pictogram. So long question to say, no, we don't have any pictograms yet. Yes, I have been advocating to develop some. And 3, I will not retire until I develop some pictograms related for diabetes self-management for migrant seasonal farm workers. That's one of my dreams.
Thank you very much. Can you talk about videos? When you talk about videos, what were the mediums that were used to share those videos? YouTube?
It might be in YouTube. It might be in some of the clinics in the waiting area, especially.
Hello? We can hear you, Betsy.
Hello, can you hear me now?
Yes, we can hear you now.
What I was saying, I lose the track. Videos, okay. Where in terms of the video, yes, some of the promoters that were interviewed, they were saying that it will be good if we can develop, basic topics around diabetes on short videos that can be showcased in some of the clinics that are serving migrant seasonal farm workers. And for some others that are not accessing healthcare in any clinic at all, which are many of them, so then many of them may have a smartphone, and so they can, through, guided by promotores de salud, get access to those videos.
Okay, thank you very much. Thank you, Betsy, for another informative webinar. Is there an effort to replicate the theater-style program?
What program?
Theater-style program.
Oh, los teatros. Okay, los teatros was developed. I don't even recall the organization that developed that. But this is a strategy that has been used for many years in HIV, and it was replicated with the lesson learned in HIV to diabetes in the field by some promotoras.
Yeah.
The whole idea here is it's what is called in Spanish teatro rodante. How do you say that in English, Diana? Mobile theater, something like that. Because
mobile will be, but we'll have to think about that one.
but because the term in Spanish is teatro rodante, and this is all about having a promotora who had been sitting together, write the script, and do like a role play in a way. So they are doing the education to a role play they call teatros, and they have between 10 to 15 minutes only to convey messages. So they make sure that the messages that they're conveyed will be substantial enough to be productive and be shared with migrant seasonal farm worker in 10 to 15 segments. So they do one on nutrition, they do one on physical activity, they do one on insulin management, so forth. They have very, very different scripts. So that's
Thank you so much.
Teatro Rodante. Yeah.
Another question. I have found interesting diabetes management handouts in Peru. Have you researched patient-friendly handouts from other Spanish-speaking countries that also have agricultural workers in similar conditions to our workers here in the U.S.?
We thought about it during the process of the audit need assessment, but due to organization constraints, we were unable to. So we concentrate the effort of the audit need assessment to U.S. literature.
Okay, thank you. Are there funding opportunities to develop DPP interventions for migrant seasonal farm workers and or Spanish-speaking Latinos in rural areas?
Well, right now, the National Diabetes Education Program has a new funding announcement opportunity, 1705. And rural communities is one of the target audiences under this new FOA. So there are some organizations that are doing that work already.
Thank you. I appreciate the webinar's data on barriers, but can you share a percentage goal of the population research as successful or on the way to a good start?
We were unable to find that data.
Thanks again.
At some point, that's what I titled this, Making the Invisible Visible, because there is a lot of underreported data.
Should medical facilities play a role also to be more proactive, serving the needs of MSFWs? I'm sorry.
There are some organizations that are serving migrant seasonal farm workers, and they have their own system. The best way to learn about this organization is going to what it's called migrant stream forums. They have the different stream forums. I had the opportunity to present in many of them in the past, but recently of last year, I was able to go to the migrant seasonal farm migrant stream forum that was conducted in Atlanta. So they were explaining there how the clinics are offering, what are the laws that regulated the services provided to these populations and things like that. So I think that one good way to learn about the clinics that are serving migrant seasonal farm workers is by attending the stream forums. And you can Google like that, stream forums, and you will able to find some of them because they are region stream forums.
Thank you so much. I didn't know about that. Stream forums. Um, Prevent Type 2 is a year-long commitment. Are there any recommendations regarding the duration of DPP programs or diabetes prevention programs for migrant seasonal farm workers or permanent Latino farm workers?
Where there is no, this is not a population that has been studied related with diabetes prevention and the national DPP. So I don't have any facts to share regarding that. All I know is that under the 1705, rural communities is one of the populations. In this migrant stream forum that I was talking about, I was able to present about the National Diabetes Prevention Program. And of course, the 1 year commitment could be a challenge for this population. Long story to say, long answer to say that we don't have data. And we don't have yet the level of experience to offer any recommendations regarding this topic.
Thank you, Betsy, and thank you to the public for all the questions that have been posted. We have more questions, but we will stop here for now. With the remaining questions, we will provide answers after the webinar. With this, as I said, we conclude the segment on questions. I want to remind you about the many ways, I remind the public the many ways that there are to communicate with the Office of Minority Health Research Center. For more information about the Office of Minority Health, please visit www.minorityhealth.hhs.gov. Next, follow us. Of course, OMH wants to invite you to follow us. So via Twitter, Facebook, and chat. Thank you. Maria, could you please go to the next slide? April, as we end the month of Minority Health Month, is a time to learn more about the health status of racial and ethnic minority populations in the U.S. The theme for this month was Partnering for Health Equity, which highlights partnerships at the federal, state, local, tribal, and territorial levels that help reduce disparities in health and healthcare. Visit the new OMH website at www.minorityhealth.hhs.gov/NMHM EIGH team. Again, at the end of this presentation, there will be a pop-up window for you to complete a short evaluation. Your feedback is valuable to us, so I encourage you to complete the evaluation. All participants who register for today's webinar will receive an email with a recording of the webinar. Thank you for joining us, and we hope to see you again in one of our future webinars. Betsy Rodriguez, thank you very much.
Thanks to all of you. Bye.